times when we still need to kind of review those worksheets to ensure accuracy. And so we always use money when we can. We don't, if we have money to spend, I mean, we spend the money that we have towards because purchase of service dollars are direct dollars for the individuals that we serve. So we are meeting IPP objectives like we always do. And if we do not use the money that's allocated to us in its entirety, then that money just stays in the system and goes back to the general fund.
Okay, but it's something that according to the executive finance meeting, there's a priority on not having an allocation balance. It's spend that POS money buying supports and services for the people we serve. Are we going to make the best effort to do that?
Of course.
Okay, so, I mean, we can do it. You can always spend money. What do we need to spend it on?
Well, in terms of purchase of service, it would be any type of needs that we have for any of the services that we're providing. And so if at the end of the fiscal year there is a surplus of funds, then it goes back to it remains in the system.
Yeah, so it goes back to the general fund.
It does go back to the general fund, correct.
Okay, but is there anything that's preventing us from spending it on our people?
If I may, my recollection when we covered this last meeting was Jesse said that it will be spent unless there isn't either staff or some other constraint, as opposed to not intending to spend it. It is intended to be spent unless there is either a staffing or some other reason that's obstacle. Is that a fair assessment, Regional Center?
It is a fair assessment.
Okay.
Okay, because I mean, you could hire a lot of service coordinators for,
not under purchase of service. So this is separate. So operations is staffing and operations of the organization. Purchase of service is funds that go towards client services. So that goes towards any type of vendor services. So you can see here, these are the areas that are captured under our purchase of service. So it's out of home placement, it's day programs, it's transportation, it's respite, and it's other services. So that is what falls under the POS. Under operations, I'm going to go up to the slide above. So operations is salary and fringe benefits. Operations, that is what is comprised under operations.
Okay. So if we bought, say, brand new furniture for the regional center office, would that fall under operations?
That would fall under operations, correct. That wouldn't fall under purchase of service. So what would fall under, I'm sorry?
Go ahead, excuse me, go ahead.
So purchase of service would be residential services, would be day programs, would be transportation. Now, some other things that also will have a really big impact in this amount right here that I'm my analysis on is there were additional funds that were allocated to cover the lag support, which is the support to our ICF facilities. And so there is still time, because this is as of April 30th. So there is time in the next couple of months, well, from April, May, and June, to utilize those additional funds there to cover some of those expenses, as well as some of the unanticipated expenses that we may have regarding like medical supplies that the managed care isn't covering until they fully accept those individuals under the managed care system.
Okay. And I suppose part of that 27 million is put there or saved there for late bills, right?
Correct.
From the vendors.
Correct.
Okay. Right.
And so we also, as you recall, we have 3 open fiscal years at any given time. And so late bills, there's a lot of times that we get calls from vendors who are billing us from last year, and trying to, they've gone through their books and they've realized that they've missed some billings, and so then we have some late billings that happen there as well.
Does this amount, $27,856,000, seem like an inordinately high amount for an allocation balance?
Yeah, let me, Lucy has her hand up, so let me have her step in as well.
Sorry. What I was going to say is that there are a lot of things that are now with the rate implementation, we're still having to do a lot of work to negotiate or reconcile some numbers, just because it's a big process. We are still needing to pay out our DSP stipends. We're still needing to loan money to our ICFs who need it because managed care is not able to have that. And so a lot of those numbers are going to come in late, because we don't know that until the last minute. The DSP stipend in the end of this month, so we still have another week, and we paid out a lot of money for the ICFs, millions already, and we're actually expected to continue that through December of 2024 for 6 more months. So a lot of the money is going to be used in that capacity, Bruce. That's my feeling.
Okay.
And then some of our day programs are going back with their capacities. They're starting to get a lot more referrals. So we're going to have funding that and funding transportation. The rate increase is not going to happen, but we are still having people return back to programs more, especially now in the summer. We are getting some social rec programs up. And so that's going to also expend some of the money that we have identified here. So just wanted to give you that feedback and that background.
Thank you, Lucina. Yes, there is still a lot of factors that are unknown, that is hard to project for. And so we start to see it as the year progresses, when we start reconciling to our actual costs. Hopefully I answered your question, Bruce.
Yeah. So we are thinking about new programs, new services that we can provide.
Absolutely.
Oh, yeah. We have a day program in development. Okay. We have 2 EBSHs in development. Yeah.
Okay.
Are there any other questions regarding our purchase of service? So I'll move on to the next. And so here is the breakdown of the items that are noted in the first 2 sheets. This is our operations, and you can see here that it comprises of the salaries, the staffing, the retirement, Social Security. So here's the breakdown of each. And then when we move on to purchase of service, then you can see how we've got the out-of-home, which is the community care facilities, the ICF facilities, day programs, medical, professional services, home care, transportation. And so the breakdown is all here. Okay, and then here is our statement of financial position. And this is the graph form of our statement of financial position, and our projected surplus and POS and operations in a graph form. Now, does anyone have any questions regarding any of the items that I have gone over?
Doesn't appear so. Thank you very much, Dara. As a reminder for the full board, the financial report was presented to Executive Finance 2 weeks ago and approved as per our bylaws. So thank you very, very much. We do have, moving on, a plethora of contracts to review tonight. Are we going to start off, Lucina and Dara, with?
Yes, I will start with Neudesic.
Okay. And so this might be last month before we have a consent agenda, but I'll tell you all about that a little bit later.
Okay, great. So I'm very excited to present a contract for Neudesic. Neudesic is a IBM company with a case management platform. This program is really going to assist us in streamlining processes and increasing tracking. We've been looking at a variety of other case management systems over the last 3 years, and several of those systems really kind of missed the mark. So there were a lot of gaps in those systems. And so when we were looking at one, particular case management system, it lacked some. It lacked the bridging component into fiscal. So that meant that our fiscal staff would have gone back to manually inputting items. And so it was almost like taking a step backwards for us. And so that's of course not what we want to do. We want to really look at streamlining processes and utilizing technology to the fullest. And so this program, Neudesic, developed Atlas about 3 years ago, and it was a project with IRC. This program was built from the ground up and continues to be enhanced. So that's the big perk behind it, is if there is something that doesn't work for us, we have the ability to enhance it and continue to develop it to meet our needs. Now, about 2 years back, Alta Regional Center and us were looking at this program, and we both kind of decided to move forward with exploring Atlas a little bit more because it truly met the needs. Since then, Alta Regional Center, Harbor Regional Center have contracted with Neudesic, and Central Valley is also in discussion with Neudesic. And so this Neudesic does offer a customization that we have, an enhancement that we have not seen in none of these programs. So we're really excited. The key takeaway points here is that it's, again, very customizable, it's scalable, it integrates most all departments in the agency. It offers enhanced reporting and tracking, streamlines processes that are currently manual. It has a scanning function that can replace our current document management system. The ongoing costs for it are low because it does require certain licenses through Microsoft, which we currently possess. There may be some additional cost in acquiring licenses that we may not have, but for mostly we have the licenses that are needed to run this program. So we're very excited. This contract was presented at Executive Finance Committee earlier in the month. And so we are just kind of reviewing it. I believe the contract is included in your materials tonight. So if you'd like to take a deeper dive into what the project scope is, you can do so by reviewing your material. Does anyone have any question regarding Neudesic?
Hold that thought. We'll get the motion
Okay.
and a second, and then we'll ask for any questions. So just as Dara said, this contract, including all of the other ones that will be presented tonight, were reviewed extensively at the Executive Finance. And what that committee does, just as a reminder, is to ask all the necessary questions in order, and then we approve them with motions so that they've already been vetted by those on that committee, and we are recommending them then to the full board. So hopefully that helps a little bit. So do I have a motion to accept this Neudesic contract as presented?
I'll make the motion.
Thank you, Bill. Do I have a second?
I'll second.
Oh, we got 3 people here.
I know, right? I'll let Erica pick. Okay. Any questions for Dara? This, I'll just reiterate, it's very exciting. I think overdue, but very, very exciting, and will definitely help, fits very well into our strategic plan.
It does. And I forgot to mention, actually, Neudesic is applying for the RFP for the SERMS and Euphism project with the state as well. So I think that this really kind of helps them develop a program that will truly meet all services with the regional center. So it's an exciting time. So thank you.
Even better. Any other questions for Dara? Okay, not hearing or seeing any. All in favor of accepting the contract as presented, please say aye or raise your hand. Any opposed? Any abstentions? All right, thank you very much. Okay, thank you, Dara. Very, very exciting times. Woo-hoo.
Thank you.
Okay, moving on.
And for the other contracts, because it says a consent agenda, do you want us the staff just to mention what those are? Because
I would love
next
that.
time. That's
But
next time.
yeah,
Okay.
yeah. I think, don't we usually have consent on there?
I don't remember seeing it. Maybe I was.
Erica, don't we usually have consent on there?
Yeah, it says
Oh,
consent.
okay.
Yeah.
Maybe
So
it's all with me today.
we're
Okay.
gonna go one by one, but next month, new fiscal year. And I'll talk a little bit more in depth about that. We'll go.
Okay. Just wanted to confirm.
And Hortensia, you're listed first.
Thank you. Good evening, board members, President Chetney, and members of the public, DDS as well. The first contract that I have to present is the one for Dr. Rebecca Perez. She's a psychologist who's supporting us with our intake assessments and assisting with our eligibility team reviews. I would like to request that you consider this 3-year contract for approval. The Executive Finance Committee reviewed it 2 weeks ago.
All right, thank you very much. Yes, at this point, any and all psychologists that we can get, I think we really want to make sure that we can secure for our individuals served. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Trish. Do I have a second? Yes.
I second.
Thank you, Jay. All right. Any questions? I'll just tell you right now that pretty much all the psychologists, they're pretty similar. Just fair warning. Any questions for Hortensia? Okay. Not hearing or seeing any. All in favor of approving the contract as presented, please say aye or raise your hand.
Aye.
Any opposed? Any abstentions?
I abstain.
Thank you, Chris. All right. Moving on.
Thank you. The next contract is for Dr. Jenny Mathis, another psychologist supporting with intake assessments, similar to the previous one that I presented for 3 years. And I would like your consideration for approval for this 3-year contract.
3-year contract. Okay. All right. Do we have a motion to accept this contract as presented?
I'll make the motion.
Okay, Trish, do we have a second?
I'll second.
Oh, okay, I heard Bill. Philip, I'll get you next time. Any questions for Hortensia? All right, all in favor, please say aye or raise your hand. Any opposed? Any abstentions?
I abstain.
Thank you, Chris.
Okay. Next contract is for Dr. Yadira Vasquez. She's a bilingual psychologist, so we're very excited that we get to keep her. And it's for 3 years as well, supporting with intake assessments, redetermining eligibility, conducting assessments for provisional eligibility as well, and supporting with eligibility, and also any forensic cases that we may have. I'd like to request your approval of this contract as well. Thank you.
Okay, do we have a motion to accept this contract as presented?
I made the first motion.
Way to go. Thank you, Philip.
Julie.
Thank you. Appreciate that. Do we have a second?
I'll second.
Thank you, Karen. Any questions for Hortensia? I just have one minor little question, and it's really not specific to this contract. You mentioned forensic in this one. Are all of the psychologists able to dive into that area, or is that like a specific specialty or certification?
It's not specific, but not everyone is comfortable doing it.
Got it.
And so some of them prefer to focus or specialize with the little ones under age 3. Some of them are very comfortable working in the jail system, going outside of the agency. So we have a very wide variety of specializations. And so what we like to do is retain a variety, and as well as the various languages. So
thank you. That was just a point of curiosity on my part. Thank you.
of course.
Any further questions for Hortensia? Okay. All in favor of accepting the contract as presented, please say aye or raise your hand. Any abstentions? Oh, sorry. I know. Any opposed? Now any abstentions?
I abstain.
Thank you. I'll get it one of these days. Okay. I think we're 4 or 5 now.
Okay, the fourth one is the psychological group. That is Dr. Cooper, who is supporting us supporting with intake assessments, redeterminations. He's not supporting with eligibility, but we're still excited that he gives us his time Tuesdays and Thursdays. Very much experienced, and I'd like to ask for your support with this approval of the contract for another 3 years.
Okay, wonderful. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Bill. Do we have a second?
I'll second.
Oh,
Thank you, Joe. All right, any questions for Hortensia? Okay, all in favor of accepting this contract as presented, please say aye or raise your hand. Any
Opposed.
opposed? Oh my gosh, sorry. Any opposed? Any abstentions?
I abstain.
Thank you. Okay, gosh.
Thank you.
Okay, sorry. That was
Okay,
weird.
last one from me is the contract for Dr. Thomas Carrillo. Dr. Carrillo has worked with this organization for many, many years, and he's very well versed working with individuals with complex healthcare needs, individuals presenting with any variety of situations related to behaviors, behavioral health, as well as the forensically involved individuals. So we're very excited that, again, we get to honor for the services that he's providing, as well as compensate and retain. So I'd like to request your approval on this last contract for 3 years.
All right, thank you. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Karen. Do we have a second?
I'll second.
I saw Joe on that one. Any questions for Hortensia? Okay, all right, I'm gonna try and get this right. All in favor, please say aye or raise your hand.
Aye.
Any opposed? Any abstentions?
I abstain.
Thank you. Awesome. All right, great. We've got some psychologists locked down for a little while. Thank you. Okay, and Tim,
Right.
you are up for our community.
Okay, great. I appreciate it. Good evening, President Chetney, members of the board, community members, RC staff, and DDS staff. I'd like to present 5 service agreements listed in this evening's agenda for the board's consideration for approval. The 3 of the 5 service agreements are for what are called specialized residential facilities for adults. These homes are licensed by Community Care Licensing as adult residential facilities and vendored by the Regional Center as a specialized residential facility. In addition to an individual's intellectual development disabilities, individuals referred to these homes and served by these homes could also have a mental health diagnosis, a sensory deficit, medical condition, and severe behavioral challenges. Due to the needs of the individuals, the homes provide enhanced staffing that includes additional direct support professionals, LVNs, RNs, psychiatrists, board certified behavior analysts. So the first service agreement for a specialized residential facility is with Monreal Management for their A&M Aurora home. Monreal Management has provided residential services to individuals served by San Gabe Pomona Regional Center since 2007. The Aurora home has been in operation since 2018, serving 4 individuals. So I'd like to ask the board for their consideration for approval.
Wonderful. Okay, great. Thank you. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Bill. Do we have a second?
I'll second.
Thank you, Trish. Do we have any questions for Tim? All right. All in favor of accepting the contract as presented, please say aye or raise your hand.
Aye.
Any opposed? Any abstentions?
I abstain.
Thank you. Okay.
All right, great. The second service agreement for a specialized residential facility is with Elwyn, California, the El Monte home. L1 California has been providing residential work and day program services to individuals with intellectual and developmental disabilities since 2005. The L1 California El Monte home serves 4 individuals, was developed using community placement plan funds in fiscal year 2012 and 2013. So unless there, I'm sorry, so I'd like to ask for the board further consideration for this contract.
Great. Okay, thank you, Tim. Do we have a motion to accept the first of these 3 Elwyn contracts?
I'll make the motion.
Thank you, Trish. Do we have a second?
I will second.
Thank you, Philip. Any questions for Tim? Okay, all in favor of accepting the contract as presented, please say aye or raise your hand. Any opposed? Any abstentions?
I abstain.
I abstain as well.
Wonderful, thank you very much. Okay.
All right, the last service agreement for specialized residence facility is also with Elwyn, California for the Rancho Lindo home. The Elwyn Rancho Lindo home has been serving 4 individuals since 2018. It also has those specialized services needed to support those individuals. So unless there are any questions, I'd like to ask the board for their consideration for this one as well.
Great, okay. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Trish. Do we have a second?
I second.
Thank you, Jay. Any questions for Tim? Okay. All in favor of accepting the contract as presented, please say aye or raise your hand. Any opposed? Any abstentions?
I abstain.
Thank you very much.
And I abstain too.
Thank you. Okay.
All right, great. The next service agreement is with California Mentor for their Mead Cliff home, which is an adult residential facility for people with special healthcare needs, or we refer to as ARFFNs. The ARFFN model is for persons with special healthcare needs. That provides, these homes provide 24-hour healthcare and intensive support services in a home-like setting. They're licensed by Community Care Licensing and certified by the Department of Developmental Services. Individuals that live in this home have intensive support needs, requiring physical assistance with physical needs. They also may have special healthcare needs such as oxygen, wound care, ventilators, dialysis that require that 24-hour nursing support. This particular Mead Cliff home opened in 2012 to serve individuals coming out of Land Developmental Center. And 4 of the 5 individuals living in the home right now were actually moved in there in 2012. These homes are closely monitored by both the regional center as well as also the Department of Developmental Services. So I'd like to ask the board for their consideration for this contract.
Wonderful. Okay. Do we have a motion to accept this contract as presented?
I'll make the motion.
Thank you, Trish. Do I have a second?
I will second that.
Thank you, Philip.
Julie.
Thank you. I appreciate that. Do we have any questions for Tim about the Mead Cliff home? Okay. All in favor of accepting the contract as presented, please say aye or raise your hand. Any opposed? Any abstentions?
I abstain.
Thank you.
All right, great. The last service agreement is for startup activities with Hope House for the multiple handicapped for an enhanced behavioral services home. An enhanced behavioral service home, these are licensed by Community Care Licensing and certified by the Department of Developmental Services to provide 24-hour non-medical care to individuals that require enhanced behavioral supports, staffing, and supervision. In this particular case, this is for startup. The startup funding will be utilized by Hope House to prepare the home for the residents, recruit and train staff, go through the licensing process, and operate the home until those ongoing services start. This home was, we received funding from the Department of Developmental Services to do this startup. Hope House was selected through a competitive process. And they will be providing services targeted towards children. The children that will initially be referred to this particular enhanced behavioral service home are those children that are wards of the state or are registered with Department of Children and Family Services. Then it would be opened up as a statewide resource to other regional centers and looking for individuals, children that would need that heightened level of service. So unless there are any questions, I'd like to ask the board for their consideration for this startup agreement.
Great. Okay, thank you. All right, do we have a motion to accept the contract for Hope House as presented?
I move we accept the contract as presented.
Thank you, Bruce. Do we have a second?
I'll second.
Thank you, Joe. Any questions for Tim? Okay. All in favor of accepting the contract as presented, please say aye or raise your hand.
Aye.
Any opposed? Any abstentions?
Abstain.
Thank you, Chris. Okay.
All right. Thank you so much.
Wow. And next month, we'll be able to do that all in one fell swoop. How great is that? And if anybody wants to know, I did write down literally in front of me, all in favor, any opposed, any abstentions, just because of my little brain fart. Gosh, okay. And it's only Wednesday. All right, we're gonna move on here to our updates from our committees. So we will start with our Community Relations Legislative Advisory Committee with Karen.
We actually did not meet this month because of the holiday. So we will be reconvening next month.
Good point. Good point. Yeah, that holiday really, you don't tend to not have them on Wednesdays. So interesting. Okay, thank you for that. The Advisory Committee for Individuals Served and Their Families. Jay.
Thank you, Julie. Good evening, everybody. Hello, and President Chetney. We have few interesting updates. And we had a special presentation by Daniela, Service Coordinator and Regional Center Operation, which are still underdeveloped. I think hopefully we'll get the more information by beginning of next year. And we have future training topics on home and community based coming up in July. Final rule presentation, future training topic. And we also have a discussion session that is via Zoom presented to parents and other community members. It's going to be on July 18th and August 15th from 10:30 a.m. to 12:30 p.m. in English, and other language follows as well in future. And we have been introduced a new Associate Director, Adults and Residential Service by Daniela. And her name is Zorinda Presicado. Hopefully I'm pronouncing her name correctly. And we have self-determination. We have more people enrolled in self-determination. So far it's 184 enrolled, and we have a few more coming up. So that's, and we have a master plan and developmental service update by Daniela, presented by Daniela. And Daniela, can you please give more information on this one, please? Is she here?
Jay, I think it's actually going to be a part of the presentation that Lucina's going to do.
Oh, okay. Okay, that sounds good. Thank you. Thank you. And that's all for now. Thank you, everybody.
Thank you so much. Okay, our Vendor Advisory Committee with Chris.
Wonderful. Thank you, President Chetney and the board. On May 31st, we did have the Keep the Promise rally held in Covina, which was a phenomenal turnout. I unfortunately was not able to be there. I got incredibly sick a couple days before and was not able to be there, but everybody that I've spoken to, I've seen the pictures and all the turnout was just fabulous. So I just want to thank everybody that was able to make it out there and for the turnout that we did have. We even made a spot on the Channel 5 News. So thank you to everybody for the incredible turnout. It appears that we've been partially effective in our efforts. The governor, instead of delaying the funding for a year, has delayed it for only 6 months. So while we were not 100% effective, it appears that we were somewhat effective in our efforts on that front. So thank you everybody for your efforts and your advocacy. On the vendor advisory committee front, we still have several positions that are open for this next term. We have recently in the last month filled 2 positions for infant and children's services as well as vocational. And we have 2 more interviews scheduled tomorrow morning for additional members to take over positions that will be turning out as well. So we're excited for some new members to be joining, and hopefully we'll be able to report back in August, as our July meeting would be held on the 4th of July. So we will be black and dark on the 4th of July, and our next meeting will be held on August, I want to say 1st or 2nd. I don't know what date it is going to be. Really quick, August 1st. So we'll be able to report back then. And that's all.
You don't want to meet on July the 4th?
I wanted to, but everybody said I was crazy. So.
Oh, gosh, people. Thank you. Thank you very much. We're going to move on to our Strategic Development Advisory Committee, chaired by Bruce.
Actually, first order of business will be for the board to vote on the appointment of a lady we interviewed for a slot on the advisory committee for people served and their families in an interview last month. Her name is Adela Shen Zimmerman. Adela has a child at San Gabe. She works for in-home supportive services and has served on various volunteer community organizations. Our committee found Ms. Zimmerman well qualified, and we'd like to recommend her for appointment to the Committee for People Served and Their Families. Do I hear a motion?
I'll make that motion.
Okay, thanks, Julie.
I'll second.
Thanks, Bill.
Second. Yep.
Okay, all in favor say aye or raise your hands. Thank you. All opposed? Great. All abstaining. Good. Okay, so Adela Zimmerman is appointed to the Committee for People Served. Also, given that she's a new committee member, she's going to need a mentor. So I'd like to put that idea out to the committee chairman, co-chairman, to appoint a mentor for her, because it's very helpful. Next, given that this is our last meeting, this is our annual meeting. So it's the annual meeting, it's time to elect new officers to the board. At our last Strategic Development Committee meeting, we nominated a slate of candidates to serve as board officers for the upcoming fiscal year. They are President Julie Chetney, First Vice President Karen Zosadiaz-Igi, Second Vice President has not been named yet, Treasurer Bill Stewart, and Secretary Trish Gonzalez. So do I have a motion to elect this slate of officers? If you wish to elect, do I have a motion to elect the slate of officers? Well, I'll make the motion. Okay, all right.
I'll second the motion.
Thanks, Chris. All in favor of electing this slate, say aye or raise your hand. Great. All opposed, say no. And any abstentions? None of those. So the slate is approved. Congratulations. It's been a really great year, and I'm glad everybody's coming back, because we still have work to do, and this group can get it done. So congratulations, everybody, and thanks for coming back. Turn it over to you, Julie.
Thank you so much, Bruce. And thank you to all the officers who agreed to continue in their roles next year. Really appreciate it. We shall go on to, there's a problem when your window looks out in the backyard and your daughter's out there. So we're gonna go on to my presentation tonight. I'm gonna share my screen. Should be pushing screen. Does this work? There we go. Okay. So I'm taking after Jesse to give a little bit of a couple of slides just to give some talking points to what stuff that I have to tell you guys, basically. So the very first thing is our VAC chairperson. So we're going to certify the VAC chairperson per our bylaws, and that certification did happen, and Chris is going to be rejoining us next year as the VAC chair and therefore board director. And so as you can see per the bylaws, we do have in writing the certification from other VAC members. So really, really happy to have you back, Chris. Okay, so I'm going to go on to just as a reminder, like what our vision is. I know Jesse in his presentation sometimes references a little bit more about our mission, how we're going to accomplish the mission, but those of us on the board, we're really looking at the highest of high levels, which is the vision of our center. So this is a world where individuals with developmental disabilities have endless possibilities and thrive. And when I post this, or I'll ask that it be put up to the meeting materials, anything that you see with blue has a link to it. And this was just, this one's a link to when we announce the mission, vision, and core values. Okay, so our new strategic plan and how it relates to the board. So with the new fiscal year coming, we're very much going to be taking a lot of pointers from that training that we had by Michelle, who helped us with the strategic plan, and really trying to target our meetings, tying them, aligning them to our strategic plan. And in that, the particular goals and the objectives that relate directly to the board are here in goal number 2 and in goal number 4. And in particular, what you see highlighted or bold and in italics. So facilitating engagement across all of our stakeholders, all of our partnerships, delivering information through digital platforms. We need to be, keeping up with the times, which is one of the reasons why we had the contract presented tonight for Neudesic. Establishing relationships with policymakers. There's a lot of advocacy that happens, and there is always opportunity for more. And so what is the board's role in establishing those relationships? Any sort of supports for the regional center and its amazing staff. So that's what we're here for in our role as board members, is as supports. And then of course, the transparency, the accountability, and then the service community satisfaction. That all kind of comes back to us. So these are the things that the board will be directly looking at and, trying to, develop some metrics for as we move forward into this 3-year strategic plan. Okay, so here's some evolutions basically out of that's going to happen starting next month for fiscal year 24-25. So the very first one is that our advisory committee meetings, 2 of them have changed in terms of their dates. And that's linked here. So it's in your meeting materials, but it's the Strategic Development Advisory Committee and the Community Relations Legislative Advisory Committee. And it's in an effort to streamline things, give staff a break, just be more efficient and working smarter and not necessarily harder. The idea of a consent agenda. So instead of having separate motions for every single contract, because tonight, how many do we have? 10. We are going to have one agenda item, one motion. Okay. There's a link here to consent agendas, like what they are, if you wanted to read more about it. But basically, in it itself is an item on the agenda where you put things that are standard and repetitive contracts. We still have an opportunity to ask questions, but we don't have to go through the steps of, do I have a motion? Do I have a second? Do we have any questions? All in favor, all opposed. And the big thing with this particular idea of having a consent agenda for all of the contracts is because they have already been presented, asked about, and approved to be moved forward to the full board by the Executive Finance Committee. So, and our bylaws do give that power. So we're gonna start doing that next month, and that should make that section a lot more compact. We are also starting next month, we're gonna have a new look to the board and committee agendas. So look for that coming soon next month. And then we're also going to, by having that consent agenda, we're going to open up some time in our meetings for discussions of items that are directly related to our strategic plan. And this came out of really great discussions going through the entire process of developing this plan, and then talking about, well, what kind of training do the board members want? And so it's been a bit of a snowball effect, and now we're actually starting to see the fruits of our labors. So there we go. Really quickly, Jesse and I were up at ARCA last week. The master plan for developmental services was mentioned, and there is an opportunity. So there's an opportunity for board members and the public, to be quite honest with you, to be a part of this. There is the big committee, but they're also looking for individuals who would be willing to participate in different work groups. And I will actually put this, let me see if I can put this in the chat. See, I should have had somebody do this for me. That's okay. Okay, so you can go to that link, and these are the 6 different work groups. And if you wanted to participate, put your application in. I did. I know Jesse was told to, and but he wanted to. So that is open until the 28th of June. I think they extended it. So if there's something on this list that strikes your fancy as a little bit of interest to you, can maybe consider joining one of these work groups. ARCA, we as a board, we approved some strategic priorities for fiscal year 24-25 for the association to work on behalf of the system. And you see everything that is of high importance to the regional center system. However, look at number 5. Number 5 is regional center system efficacy and supporting regional center boards. So ARC is really going to do quite a lot to try and support us in our volunteer roles as much as they can. And there is an ARCA Academy that's coming in September, and it's going to be held over at our sister regional center in Inland Regional Center. So look for more information on that to come. Last thing I wanted to do was to, we don't have time to see this video, although I would love to. I'm just going to copy this link and put this one in the chat. This is a wonderful video by Tri-Counties Regional Center. So their outgoing president, board president, is a retired movie producer and was part of Reading Rainbow and all that kind of stuff. So he's got the, it's his jam, basically. And so he got together, he asked for some money to put all this stuff together, and they did a whole series of videos about the HCBS final rule. And now they have this one. Basically, it's a 15-minute video basically saying, what does it mean to be a board member of a regional center? And it is worth checking out, and it is worth spreading as far as the eye can see. Once again, it's on the Tri-Counties Regional Center YouTube page. They have a YouTube page, but the link is in the chat. So if and when you have 15 minutes, please take some time to check that out. It's really worth watching. And that is my report for tonight. We shall move on to our executive director's report. And we have Lucina with us tonight.
Sorry about that. Good evening, everyone. Jesse is out of town tonight, so I am sitting in for him. And Elba, if you can put up the PowerPoint that's Jesse's, I appreciate it. Thank you. Thank you, I appreciate it. And Jesse did all the work for this, but I am just his presenter. So he did a lot of work, even though he's out of town. So thank you ahead of time to Jesse. So next page. One of the things that, next page, Jesse wanted me to review was the master plan. There was some comments about it earlier, but on the master plan, I think you were asking about it, Jay. Daniela presented it at the individuals and families served meeting. But there is a master plan of developmental services. There's representation from all around California from the regional center system on this master plan. I saw Dr. Yin's name on there. He's our medical director and he's one of our physicians here. So I was glad to see that. But it is the California Health and Human Services Agency. They're looking for people interested in joining the master plan of developmental services, the work group. There are 5 work groups and they're going to develop recommendations to improve our system. The work groups are going to meet monthly for approximately 3 hours by Zoom. They're going to start in July and end in early 2025. So it is a commitment, but probably a grand commitment that's going to provide a lot of benefits to our system. Each work group will have a chair or core chairs appointed by the California Health and Human Services Agency, and they are supported by the master plan staff. So they're on the website, and I don't know if we have that link in here. I'll look. I know that we just got it today from Jesse. They list all the meetings that they're going to be holding on the master plan, and so those are already identified. Next, thank you. Oh, here it is. Group 1, individuals and families experience person-centered service systems that they trust. The group 2 is the individuals receive timely, inclusive, and seamless services across all service systems. Group 3 is going to be about individuals and the families who receive services from a high quality, stable, and person-centered workforce. Group 4 is individuals and their families experience consistent, transparent, accountable, and data-driven systems that focus on outcomes. And group 5 individuals are entitled to lifelong services with adequate resources. Apply by June 28th. Here is the link. It's in your documents. The survey to apply is included in this Survey Monkey. And that's, I think, Jay, what Daniela shared with the group earlier tonight. Next. So state budget updates. I know Chris reviewed a little bit of it, but this year's state budget was finalized. with the context of 46.8 billion deficit. Since Governor Newsom released his initial proposed budget in January, which included a 12-month delay in $1 billion of new funding for regional center services, the legislator held dozens of budget committee hearings to develop a plan that addresses the deficit. And the outcome, the final budget agreement successfully pushed back the governor's proposal of a 12-month delay and shortened it to a 6-month delay. So while we didn't get the entire wish, it was only delayed 6 months. So there are some positives that came out of that. The full press release can be found in your documents. There is a link for that. In relation to our system, it does say that delays of the implementation of the provider pay by 6 months to January 1st, 2025. So that was the big outcome for us. Funding for the Regional Center Health and Safety Waiver support was ultimately included in the fiscal year 24-25 budget as well. And the final budget included a reduction of $18.6 million in overall funding for the 3-year Regional Center Staff Tuition Assistance Program. Implementation and further instructions will be forthcoming from the department. Trailer bill language, SB 162. This is a statutory requirement for the development of the master plan for developmental services. Implementation of the final phase of the rate models is also included in here, and that's for January 1, 2025. Allowance for remote IPP and IFSP meetings if the individual has been seen in person in the last 12 months for IPPs and the last 6 months for IFSPs. So that's a change. Using statistical practices to more efficiently complete provider audits. And then elimination of the family cost participation and the annual family program fees. That's a big win for our system. So it's not going to affect our families cost-wise. Changing the timing of assessments for children who are provisionally eligible, and then updating the social rec statutes to include a requirement for identification of a regional center contact to DDS and training for some staff. And then we did get a DDS directive on reporting requirements for SANDIS, which is our system. I think Dara talked about it, having a new system, but this is the system that we have for IT, for anything that we have in terms of storing our incidents, storing our data. It's called SANDIS. But effective June 17th, the following report elements will be added to SANDIS regarding self-determination. The date the orientation was completed for the family or the individual served, who was the orientation provider, the date of the initial budget meeting, the date the individual budget was certified by the regional center, and then budget adjustments. What is the date of the change, the reason for the change, and the budget change? Was it an increase or decrease or no change? And so these are additional data points that we will have to enter for the 184, I believe, individuals that we currently serve under self-determination and anybody in the future. So this is new for us. Regional centers will enter the information for all individuals in the process of enrolling in the self-determination program as each steps of enrollment is completed. So as we finish the orientation, as we do the budget, as we do the spending plan. Additionally, regional centers are required to retroactively enter the information, including the budget history for all current and previously enrolled self-determination participants by October 31st, 2024. So we do have a deadline for current and previously enrolled participants. These additional elements will support the department's effort to track enrollment data for the self-determination program. And then ICF lag funding extension. So we talked about it probably in the last couple of meetings that our intermediate care facilities, which are typically funded by Medi-Cal, switched to managed care, and it has not been an easy transition. And so part of what regional centers are doing is we have been lending the intermediate care facilities money to continue to operate because a lot of our folks live there. We probably serve around 500 to 600 people in our ICFs. And so the deadline was to end in June, but it's going to be extended from January 1st through December of 2024. So it's going to extend for 6 more months. And we need it because we still need to help them transition into managed care. Another directive that came up, and this is actually in Dara's division, she's assisting with this, is the vendor rate adjustments for employee sick leave. So Senate Bill 616 modified the Healthy Workplaces, Healthy Families Act, entitled employees who work on or after January 2024 to accrue 40 hours or 5 days of sick leave or paid time off by the 200th calendar day of employment each calendar year or 12-month period. Title 17 allows vendors to request a rate increase if necessary in order to comply with the new sick leave mandate. So because our vendors have this new mandate, we're going to help them get a little bit higher rate by helping them with some worksheets, sort of like we do for the minimum wage increase. So the director provided clarity on the types of vendors that are affected with the new sick leave mandate, the process for how regional centers address vendors with rates who are set by the department and rates through negotiation with the regional centers, and community care facilities and alternative rate models. So in this example, the rates that are negotiated with the regional center, we will do that cost. Rates that are determined by the department will do those costs. And then community care facilities, they will automatically get those sick leaves in their rate back to January 1st. And so there's 3 different ways that we're working with this new sick leave project. And then our staffing statistics from May 31st, 2024. As of May 31st, we now have 526 authorized positions. That is huge. I started when we had like 150, so for me it's like 5 times the growth. This total number includes 512 full-time equivalent employees, 520 headcount, and 14 vacancies. We have 4 new positions that were added and they were all service coordinated positions. Recruitment continued for May and June. We had 7 new service coordinators. This is our recruitment. We are looking for 7 service coordinators, 1 psychologist, and 2 part-time psychologists. Positions scheduled to start in June. We have 4 new service coordinators beginning in June and 2 on-duty support specialists for our on-duty division and 2 self-determination support specialists as well. And then as of May 31st, we are now serving 17,175 individuals. From May 1st through May 31st of this year, are going to start admissions, which is birth to 3 years of age, received 230 referrals. 194 were found eligible for early start. For Lanterman admissions, which is 3 years through adulthood, we received 55 new referrals and from the previous referrals, 37 were found to be eligible under Lanterman. And then exiting early intervention at 3 years of age, we found 41 that were eligible under Lanterman and 2 under provisional Lanterman eligibility. And then our self-determination statistics. As of May 31st, we have 184 participants enrolled in our program. There were 9 new participants this month, and that's a big growth. Typically we have 4 or 5. 9 is probably double. We do have, as you know, a dedicated self-determination team that continue to develop and promote training opportunities to further and enhance the implementation of this program for anybody who's served by our regional center. Additionally, the team aims to bridge any disparities for underserved communities. They are training and providing support groups that are offered in English, Spanish, Chinese, American Sign Language, and other languages as needed. The team continues to collaborate with their local volunteer advisory committee to develop training opportunities and support groups to further enhance the implementation of this project. And they do meet monthly. I think it's the 2nd Tuesday of each month. And then legislative information. The Lanterman Act is now available in Spanish and can be accessed through the DDS website. And there is a link on there if you have the document in your folder. And then independent living, supported living, coordinated family support services, and social rec vendors resource fair. So our client services division is sponsoring a resource fair for vendors. Independent living and supported living providers, our coordinated family support services, and our social recreation vendors. It's going to be a resource fair for families and individuals served. Save the date, everybody. It's going to be on August 29th, 2024 from 2 to 4. And the location will be here at our regional center. So it is an in-person resource fair. And it's really to have the families understand and visit and get to know some of these providers who are providing these services. And all of these services are one-on-one services: independent living, supported living, coordinated family support, and of course, our social rec. And then next, was that it? Okay. That is it. That is the executive director's report.
Thank you so much, Lucina. I was writing down. I was like, okay, Thursday, August 29th, 2 to 4 p.m. I'm just writing it down so I don't forget. And then I realized it's in the meeting materials, but
yes.
Thank you.
Sure.
Okay, I have to go over to back to my agenda here. We do have only 6 minutes off. Woo. All right, we have a special presentation tonight on the performance contract 24-25 by Sal Gonzalez, our Director of Service, Access, and Equity.
Good evening, everybody. How are you? Thank you for that, Julie. Just want to welcome all of you tonight. And I had the pleasure of presenting this performance contract. I know that you as board members have had an opportunity to take a look at it, and wanted to share that our presentation went very well. We did have representation from our board. We had Bruce in attendance, so thank you, Bruce. But honestly, for us, we're very excited about the fact that, the feedback that we received that afternoon was very positive. We have had some updates to make to the activities. We've had some internal information. So what we're going to be doing is updating those activities tomorrow. But what I really want to do tonight is just kind of do a high flyover of some of the information that we currently have. Let me just, so as you can see here, it's a pending board approval. And what I'm going to be doing is just kind of highlighting some of the information. But what we talked about is, like, for instance, for children served by San Gabriel Pomona Regional Center that live with their families, we really kind of, as you can see to the far right, all the activities that we have. So I'm just going to focus on a few, but providing trainings to parents on topics such as behavior intervention, adaptive skills to increase the family's capabilities to maintain their children in the home. This includes online trainings. And I could tell you that in the year 2023, we had over 12 community information trainings where we had 1,000 participants come to these trainings. We also talked about, if you could see the letter E, advocate for the use of generic resources. We had a few generic resources in attendance to provide that training. And we also partnered with Department of Mental Health to provide a total of 10 workshops. And these workshops were provided in our threshold languages, including English, Spanish, Chinese, Korean, Vietnamese, and American Sign Language. So these are a few of the items that I'm going to touch on Measure 2. So we're very excited. Like I said, it's the fact that we're continuing to do our community information forums. We just had a presentation on housing from Lisa Cypress, our housing specialist. And we had, I believe, over 100 participants. And that we're going to be talking about that measure as well. Measure 3, adults live independently with or without paid support. One of the activities is for service coordinators will offer adults and their families an opportunity to discuss various living options, such as independent living, supported living, and adult family homes. Will provide written information about these living options upon request. And I could tell you that one of the things that we've been doing is providing training such as living options. We talk to our community about, what are these homes like? What type of services do they provide? What type of supports? And a lot of families that are still not, ready for that situation, it's good for them to be aware. And these are the comments we've heard. Thank you for providing this information, because this is something I haven't thought of. But the fact that I know that this is what the type of services they offer really brings a lot of comfort to me, knowing the fact that if I ever have to utilize this support, it's something that I'm comfortable with. And, these are the type of information. We just want to make sure our community served is aware of all the services we provide. In regards to Measure 4, adults live in their own home. I already touched on Lisa Cypress does an amazing job with Lucina Galarza and her entire team of locating affordable housing, and the options that we get as they're coming into us, like kind of hot off the press. That information is being shared with our internal staff so that way they could provide that information to those they serve. But like I mentioned, these are the type of trainings. We just had an enhanced conference in the city of Monrovia, where our housing specialist was in attendance and was able to provide a lot of that information to those families. Measure number 5, adults live in a certified family home along with no more than one other person with developmental disabilities. These are things that we're constantly, as a regional center, just making sure that we are providing these type of options through our, just the community resource department. So for us, we're very excited about the fact that when these things are occurring, this information is being rolled out to our staff, so that way they're aware of the type of supports that we could provide to our adult individuals. In regards to adults living with their families, again, it goes back to, just training, making sure that we're providing the type of generic resources, the internal services we provide, so families are best aware and prepared to provide the services for those adults to remain in that natural support. So for us, these are things that, like I said, from the trainings we're providing to staff to be aware of the services, but most importantly, the community information that's being presented. And I know for a fact that our adult department also does an amazing job of being out there providing information. And it starts with Rosa Chavez's department in the sense of being out there in the community, talking about the supports we provide as they're transitioning from the school services. I'm gonna go over to measure 8, children served by SGPRC who require licensed residential care. Again, these are things that if that need is needed, we're making sure that we have the beds to support these individuals, especially working in partnership with Department of Children and Family Services. We're also making sure that, if it's even needed for a short period of time, that we're discussing about that type of support with our families, and our staff is aware of this. And these are things that we do share with families at the IEPP visit. Adults served by SGPRC who reside in a licensed facility that live with 5 or fewer adults. These are things that we're constantly looking at. But for us, it's just making sure that we're constantly working with these facilities to make sure that we're developing and we're discussing with families to make sure that we're providing the best, least restrictive environment if that's what's needed. Now, I'm gonna let Lynn Lee talk a little bit about the employment measures. Lynn Lee.
Hi, thank you, Sal. Good evening, everyone. So my name is Lynn Lee, and I'm the employment specialist over at San Gabe. So in reviewing the performance contract measures for employment, we have the same 9 measures that we've had in our previous years. And the measures are actually broken up into 3 categories. So typically measures 10, 11, and 12 focuses on annual wage reportings of earnings for our individuals that work. And then measures 13 through 15 focuses on data points for our paid internship program, primarily reporting wages of those, hourly wage of those that are participating in paid internships and how many hours they work, as well as the success rate of exiting from a paid internship into a competitive integrated employment job position. And the final 3, 16 through 18, focuses on incentive payments made to our vendor community for job placements of our individuals into competitive integrated employment. Now, many of the activities do remain the same. We will continue to work collaboratively with our local educational agencies, Department of Rehabilitation, as well as our community partners in promoting employment and sharing information and creating pathways for our individuals to gain competitive integrated employment, as well as encouraging our staff to continue to have conversations with individuals and the families about job opportunities out in the community. Where we are adding to the activities this year is in relation to our newest program service, which is the Coordinated Career Pathways, CCP. And this new program service is really designed for our individuals that are within 2 years of exiting secondary education and individuals who are exiting sub-minimum wage placement. And the idea behind the Coordinated Career Pathways is really to help our individuals identify what career pathways they have in mind and help them facilitate the success of developing a plan and getting a job in their chosen career, or simply just assisting them in perhaps understanding all the nuances when it comes to working and connecting them with generic resources as well. So that is the biggest change that we're going to be looking at, and the activities associated with that is primarily going to be recruiting, encouraging our vendor community to have the CCP as a service delivery model for their program. And then as well as in educating our service coordinators and our stakeholders and our individuals in what the requirements are for the program and how to access the program. And that's all I have. Any questions?
Thank you, Lynn. And I'm gonna stop sharing my screen real quick. And for us, these are things that we're very thankful of all our specialists, because for us, as we're having these meetings with our community, they've all been very, very, welcoming to being present at these informations, and our families are getting the opportunity to talk to Lynn Lee about these type of supports in regards to employment. They're getting the opportunity to talk to Lisa Cypress in regards to housing. They're getting the opportunity to work with our mental health team. So for us, as you can see the activities where I did do a high flyover, I'm really comfortable with the fact that I feel that our activities are it's going to be really good things for us to be focusing on in this upcoming year, and making sure that we support our community in the best possible way. So at this time, I would like to ask if there's any questions or comments. But if there is, like I said, we'll have the opportunity to still make any adjustments. But what we're hoping for tonight is to get a board approval for us to move forward with our performance contract.
Sal, I've got a couple of questions.
Yes, Bruce.
Do we still contract with work activity centers, or are we trying to place people in jobs out in the community? Like workshops.
Can I respond to that, Sal? Okay.
Yes.
We do have two large, and actually Lynn is our contact for our work activity programs. We do have two large work activity programs. One is going to be closing soon, and they're moving their individuals to either their community-based day program, their supported employment settings. They have supported employment as part of their array of services. And we have a second large work activity program. We are working with them at developing a day program, but we are not at the same spot that we are with the previous work activity program. We still have a little bit of work to do with that second one. They are not going to be able to stay open past December, because they are all going to lose their certificate to be able to pay sub-minimum wage.
So this is system-wide?
This is, yes, system-wide. Sub-minimum wage will go away. So they can remain open, but they have to pay everybody minimum wage. So if they can afford to pay everybody minimum wage, they can stay open. But if they can't, most people cannot, they're going to need to close their doors and decide on a new type of option. We have been working, I'm going to say, at least 6 or more years to try to get the work activity programs to think about other options. It's just taking us longer for some programs. I don't know if you want to add anything.
Okay,
No,
given
pretty
that
much
subminimum wage has been mandated out of existence, has that affected the demand for our labor for the people that we want to place into jobs?
What do you mean? I mean, has that increased our demand?
Well, I mean, is there as big a demand for our folks, given that they're going to be making a lot more money? Is the demand still there like it was prior to subminimum wage?
Well, providers who are looking for employment have to do a lot of work to find the employment, right? They do matching, they work with people they know, they pound the pavement, they make phone calls, they hire job developers. It is not an easy task, but it is a welcome task for us to have them do that for us. And we do have programs that we vendor to do direct placement as well. Those are called our employment facilitation programs. And we do have another program, it's called Coordinated Career Pathways, which is really trying to find kind of like a career counselor and an employment counselor to help find jobs or career path for those who are exiting work activity programs and those individuals who are exiting secondary education. And so that's a new path. And so that's going to, I think, help with placing our individuals in work activity programs out in either colleges, post-secondary education, finding their career path, finding employment, or wanting to find a different path for them. We do have some individuals who are older and maybe they want to retire, so we also have to look at that. I don't know if you want to add anything, Lynn. She's the expert on this area.
Right, and the department does recognize that it is a lot of work. There's a lot of energy put into helping our individuals obtain competitive integrated employment. And that is why there are incentive payments made available to our vendor community. So when an individual is job matched or placed in an employment in the community, the vendor then is able to have receive incentive payments. And this will then help them because obviously it is, it's a lot of work. So we want to be able to recognize that the hard work that they do.
Are vendors hiring our folks?
Some of our vendors in the past have hired our individuals, yes, and it's wonderful when that happens.
Yeah, it seems like they would be desirable workers because of their experience.
Absolutely. We have a lot of wonderful individuals out there with skills that are just amazing. And I know when our vendor community, we all recognize that. And it's wonderful to see because it's really showcasing that, we really believe in our individuals, right? But yes, we have had several vendors hire individuals on and vendors that aren't necessarily employment vendors. We've had individuals that have worked in residential facilities before, in ICFs before. So that's kind of not just our employment vendors hiring the individuals themselves, but actually placing them with other vendors that could benefit from the skills that they have to offer.
Yeah, right.
Okay, thank you for that. So as Sal said, we need a motion to accept the performance contract as, as presented.
I'll make the motion to accept the performance contract as presented.
Thank you, Bill. Do we have a second?
I'll second.
Joseph.
All right, I got Joseph on that one. All right, any further questions tonight for Sal or Lynn? They did a great job.
Well, thank you very much.
All right, all in favor of accepting the contract as presented, please say aye or raise your hand. Any opposed?
Aye.
Any abstentions? Unanimous. Thank you so much for that that presentation. I like that new program. that CCP. It sounds like it bridges a nice gap, doesn't it? Okay. All right. So we have okay. Before I call for an adjournment, do we have any other board or community announcements? Except to announce to board members that we are going to go into a very short little closed session here tonight. Oh, Lucina, I see your hand.
Sorry, just really quickly, on our website today, an announcement went out. We are getting ready to look at projects we want to develop for this next fiscal year. The department sent out an email to us, I'm gonna say yesterday, saying we have 30 days to submit our proposals for a community resource development plan. Those are the monies that allow us to develop specialized homes, specialized services. The ADU is one example, multifamily housing is an example, social connection for teens, for adults, those programs that are in need. But the only way we can ask for projects and identify projects if the community identifies them as a need. So we need everybody, individual served, family served, service coordinators, staff, vendors, to go and do that survey for us so we can have some outcomes and we can find out what it is you want us to develop this next fiscal year. So it's really important. We have to the end of the 25th, or it's only gonna be up for 2 weeks because we need to review the data, figure it out, find out what you wanna develop, check with our case management staff as well, and then propose our projects. And so, please, the only way we can identify needs is for you guys to tell us what you need. So that's my ask. The second thing is that we have a lottery. We developed the accessory dwelling unit. We're getting ready. It's being built from the ground up. It's going to be probably ready in September. But we have a lottery. It's a 2-bedroom, 1.5 bathrooms. We're looking for 2 adults. They do not have to have documentation in terms of living here. They don't have to qualify for HUD. It's $431 a month rent. We are doing a lottery. Tim and Lisa, our housing specialists, are in charge of that. It's going to be on a Zoom. I don't know how he's going to do it, but we're going to choose 2 names. We do have 10 applicants right now, but we're looking at as many as possible. I believe it closes at the end of the month. So there's a couple more weeks left. Please, if you have any self-advocates who are interested in moving out or moving to a new place that's more affordable. It is in the city of La Puente. It does have its own yard, have its own spot for parking in case we have independent living or a supported living provider going into a system. It's also going to be clear for non-AMP, so people in wheelchairs, people in walkers. It's going to have bathrooms that are accessible, its own washer and dryer, stackables, oven, refrigerator. It's not fully furnished, but it will have the appliances. So just wanted to make sure you guys were aware of that. It's exciting, and we're looking forward to that project. And then, Julie, if we have an open house, we'll definitely let you all know so you can take a look at it. It will be the first ADU in the state that's kind of like an affordable housing project.
Oh, wow.
Yeah.
Okay. Yeah, that sounds great.
Thank you.
Okay,
Trish, I see your hand.
Yes, hello. I just wanted to give a quick update. I had already shared with Julie and Jesse is that last week, the week before, can't remember when, I had the opportunity to see and meet with Senator Rubio. And it was after the event, Chris, that you were talking about, and she was so wonderful. She was just completely blown away with Regional Center. And I thanked her on behalf of the board and the staff, and she couldn't have been more gracious. Let us know that if we need anything, to make sure to reach out to her office. And there were definitely a lot of our clients that left a lasting impression on her. So I think Tina was one of them, Bruce. So, I just wanted to share that with all of you. So yeah, so she was very impressed with us. So thanks, everybody.
Thank you, Trish.
That's awesome. All right. Thank you, everybody. Board members, I promise it will be short. We do have a closed session, but everyone else, stay cool and have a great month, and we'll see you next time.
Thank you. Good night, everyone.
Good night. All right, I still, let's see, 1, 2, 3, 4, 5, 6.
You still have a couple interpreters, Julie.
Yeah. Who am I missing?
We're missing Sam, Richard, and Philip. They signed off.
They did. I did see that. Okay. Let's see.
We have one more, Ali. I don't know who Ali Dory is.
We'll give it, I don't know, 30 seconds or so, and then I will.
Can I take him out and put him in the waiting room?